Hello everyone and welcome back. My name is Dr. Ben Osevwe and today we are going to talk about OCD, which stands for Obsessive Compulsive Disorder. This lesson is for PMHNPs, PMHNP students, families, caregivers, and anyone who wants to understand OCD in a simple and practical way. By the end of this video, you should be able to explain OCD. We will talk about what OCD really means, what happens in the brain, the neurological, psychological, and social root causes, treatment options, and nutritional or vitamin supports that may help support the nervous system. Short disclaimer. This video is for education only. It is not medical advice, diagnosis, or treatment. OCD can be serious and very distressing. If you or someone you know is having suicidal thoughts, thoughts of self-harm, severe anxiety, inability to function, or feeling unsafe, please seek help from a licensed healthcare professional or call emergency services. In the US, you can call or text 988 for the Suicide and Crisis Lifeline. Part 1. What is OCD? OCD is a mental health condition where a person has obsessions, compulsions, or both. The National Institute of Mental Health defines OCD as a long-lasting disorder where a person has uncontrollable, recurring thoughts called obsessions, repetitive behaviors called compulsions, or both. These symptoms can take a lot of time, cause distress, and interfere with daily life. A simple way to explain OCD is this. OCD is when the brain gets stuck on scary, unwanted thoughts and then pushes the person to do certain actions to feel safe or relieved. Think of OCD like a broken alarm system. The alarm keeps saying, something is wrong. Check again, wash again, ask again. Repeat it again, make sure. What if you are not safe yet? The person may know the thought does not make sense, but it still feels powerful. OCD is not just liking things clean. OCD is not just being organized. OCD is not just being picky. OCD is not a personality quirk. OCD can be painful, exhausting, and time-consuming. A person with OCD may spend hours washing, checking, counting, repeating, praying, or mentally trying to fix a thought. Part 2. Obsessions and compulsions. To understand OCD, we need to understand two words: obsessions and compulsions. 1. Obsessions. Obsessions are unwanted thoughts, images, feelings, doubts, or urges that keep coming back. They are not wanted. They feel intrusive. Examples include, what if I get sick from touching this? What if I accidentally hurt someone? What if I left the stove on? The key point is this: obsessions are not the same as desires. A person with OCD may have a scary thought and become terrified because they do not want it to be true. 2. Compulsions. Compulsions are behaviors or mental actions a person does to reduce anxiety, prevent danger, or make the obsession feel better. Examples include washing hands over and over, checking locks, doors, stoves, counting, repeating words or actions, asking for reassurance, searching online for answers, praying repeatedly, reviewing memories in the mind, avoiding certain objects. Compulsions may bring short-term relief, but the relief does not last. Soon the doubt comes back, and the person feels pushed to do the compulsion again. Mayo Clinic describes OCD as a pattern of unwanted thoughts and fears, called obsessions, that lead to repetitive behaviors called compulsions, causing distress. Part 3. What OCD can look like. OCD can show up in many different ways. Some common themes include contamination, OCD. This involves fear of germs, dirt, illness, or chemicals. A person may wash, clean, or avoid touching things. Checking OCD. This involves repeated checking of doors, locks, stoves, assignments, emails, or body symptoms. Harm, OCD. This involves unwanted thoughts about harming oneself or others. This can be very scary for the patient. Scrupulosity. This involves religious, moral, or spiritual fears. A person may worry about sinning or offending God. Symmetry or just right, OCD. This involves needing things to feel even, balanced, exact, or complete. Tapping or redoing actions. Relationship OCD. This involves repeated doubts about relationships. A person may constantly ask, "Do I really love them?" even when things are fine. Purely mental compulsions. Some OCD is less visible because the compulsions happen in the mind, like mental checking or praying. Part 4. Neurological root causes. What happens in the brain? OCD is connected to differences in brain circuits that manage fear and habits. 1. The brain's error detector. In OCD, this error detector may become overactive. It keeps saying something is wrong. Check again. OCD is like having a brain alarm that keeps ringing even after you already checked. 2. The cortico-striatothalamo-cortical circuit. For PMHNP students, this is a loop that connects parts of the brain involved in habits and urges. In OCD, this loop may get stuck. It is like a song repeating over and over. The brain sends the same warning message repeatedly. 3. The prefrontal cortex. This thinking center tries very hard to solve the obsession, but OCD asks questions that cannot be answered with 100% certainty. 4. The amygdala. This helps detect danger. In OCD, intrusive thoughts trigger the fear alarm even when there is no real danger. 5. Serotonin, dopamine, and glutamate. Serotonin helps regulate mood and anxiety. OCD is like a brain network getting stuck in a loop. 6. Genetics and family history. OCD can run in families. Stress doesn't cause OCD by itself, but it can trigger symptoms or make them worse. Part 5. Psychological root causes and patterns. These patterns may not be the only cause, but they can keep OCD going. 1. Intolerance of uncertainty. Life rarely gives 100% certainty. Treatment helps the person learn to live with normal uncertainty. 2. Over-responsibility. Some people feel responsible for preventing every bad thing. This creates extreme pressure. 3. Thought-action fusion. This means the person feels like having a thought is almost the same as doing the action. But thoughts are not actions. 4. Perfectionism. 5. Avoidance. Avoidance brings short-term relief but teaches the brain that the trigger is dangerous. Your world becomes smaller. 6. Reassurance seeking, asking, "Are you sure?" lowers anxiety for a moment, but then OCD asks again. It feeds the cycle. Part 6. Social root causes and environmental contributors. OCD is also affected by a person's environment. 1. Family accommodation. Families do this because they care, but accommodation can accidentally make OCD stronger. Education helps families support recovery. 2. Stressful environments. 3. Stigma. 4. Culture and religion. These can shape OCD themes like scrupulosity in highly religious backgrounds. Part 7. Medical and diagnostic considerations. OCD can overlap with other conditions like anxiety, depression, and ADHD. Important distinction. OCD involves intrusive obsessions. OCPD is about rigid perfectionism that the person sees as the right way. They are different. Part 8. Treatment options for OCD. The good news is that OCD is treatable. Treatment works best when it targets the cycle directly. 1. Psychoeducation. Patients need to know. Intrusive thoughts are common. Compulsions keep the cycle alive. Recovery means facing uncertainty. 2. Exposure and response prevention, ERP. Exposure means gently facing the trigger. Response prevention means resisting the compulsion. For example, touching a doorknob and not washing immediately. The goal is to teach the brain, "I can handle anxiety without the ritual." 3. CBT. 4. Medications. Common options include SSR is like fluoxetine and sertraline. clomipramine is another effective option. For students, remember, OCD often requires higher SSRI doses and may take 8 to 12 weeks to show a response. Do not stop suddenly. 5. Augmentation. 6. Family therapy. The goal is to support recovery without obeying OCD. Lifestyle habits like sleep and exercise also help. Part 9. Nutrition, vitamins, and supplements. Food and vitamins do not cure OCD, but they support overall brain health. Helpful habits include regular meals, vegetables, healthy fats, and limiting excess caffeine. Too much caffeine can increase racing thoughts. Nutrients like omega-3s, vitamin D, B vitamins, and magnesium may support the nervous system, especially if someone is deficient. Caution: talk with a provider before starting supplements. St. John's wort and SAMe can interact with medications. More is not always safer. Part 10. How to explain OCD to a patient. Use simple language. OCD is like a false alarm in the brain. Having a thought does not mean you want it. Your brain is asking for 100% certainty, but healing grows when we tolerate uncertainty. Part 11. When OCD is an emergency. OCD becomes urgent when symptoms create safety concerns or severe impairment. Seek help if someone has suicidal thoughts, self-harm plans, or inability to care for basic needs. In the US, call or text 988. For PMHNPs, always ask clearly, are you having thoughts of hurting yourself? Are you using drugs to cope? Do you have support at home? So today we learned that OCD is more than being neat. It's a real condition where the brain gets stuck in a loop. But it is treatable. Again, my name is Dr. Ben Osevwe. For support, you can text 832-991-6516. Please subscribe to our YouTube channel and join our mentorship family today. OCD may demand certainty, but healing grows when we practice courage, tolerate uncertainty, and take recovery one step at a time. Thank you for watching.